Hi Amanda, my name's Kristen. I'm a student of physical therapy with MU. I'm here today on a referral that you just had a total knee replacement. I'm here to give you some physical therapy. We're going to start off with some basic tests, just vital signs, and then testing your range of motion, seeing how painful that knee is, and then I'm going to take you down to physical therapy, all right? Are you okay with getting up, moving, doing some tests, and then heading down to therapy?
Yeah.
All right, can you repeat for me what exactly we're doing?
We're going to do some tests and you're going to check my knee and then we're going to go down to physical therapy.
Okay. All right. And just so you know, I have washed my hands and I brought all my tools and stuff with me. All right, so Amanda, we're just going to start with you relaxing right there. Okay. What I'm going to need you to do is just relax this arm. Now, are you okay if I take your blood pressure on this arm? You don't have any surgery history, or your doctor's never told you that you can't do blood pressure on this arm?
No, that's fine.
Lift that up for me. And just let that arm totally relax there. Very good, Amanda. I got about 130/85. Is that about normal for you, do you know?
A little high.
A little high? All right. Is that because you're in a lot of pain, or how are you feeling pain-wise? Could you tell me on a scale of 0 to 10, with 0 being no pain and 10 being worst pain you've had, about where you are on that scale?
Just laying here, probably 4.
4. And I just want you to let me know if that pain goes up a lot while we're doing our testing and stuff today. And now I'm going to take your pulse. Again, just relax. Alright, got 68 there. Is that about normal that you know of?
I think so.
Okay, good. Alright, Amanda, now we're going to do some mobility check on this lower extremity. Alright, we'll start with that leg that didn't have surgery, so I'll pull this under. And again, especially when we get to that other side, just let me know if you feel any pain with this. But let's go do some stretching those hamstrings. Feel how that, not stretching, that hip, see how that moves, that knee. Back up. Good. Looking pretty good on this side, and you don't feel any pain going over to the other side while we do that? All right, now we're gonna do this ankle. So, see how that moves. Looking good on that side. All right, we're gonna move to that other. All right, gonna be careful here, but you just let me know if I'm not quite careful enough. Let me know if I'm causing you any pain here. Okay. Not bending that knee, just lifting that hip. How's that feel?
Okay.
Feels okay? Alright, not seeing any bad limitations there. Good, no pain. And now we'll test that ankle, see how that moves. Looking good, and any pain with this and that knee? A little bit, just a little bit? Okay. Alright. Amanda, just a little bit of information. I know a lot of people like to put pillows under their knees as they're here, but you want to avoid that, because what that'll do is that could potentially get that knee stuck in flexion, and we want you to get your full extension back. So don't let nurses or anything put a pillow under those knees, okay? Okay. All right. Okay, now we're going to do some sensation tests. So you're just going to lay right there. I'm going to do is take this little cotton swab, and what I want you to do is just tell me whenever I swipe it like that. Did you feel that?
Yes.
Whenever you feel that, just let me know with a yes, okay? All right, and I'm going to need you to close your eyes for this test. So here we go.
Yes. 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 Yes.
All right, very good. All right, go. And now we're going to do a comparison test, and what I want you to do is just tell me anytime I swipe one side, then I'll do the other in the same spot, and tell me whether they feel the same or different, okay? Did you feel a difference in those two?
Well, I only touched one side.
Okay, here we go again. That and this.
You only touched one side again.
Here we go. This and that.
I only felt one side.
And then this side and that side.
Only one side again.
Okay. What about this and that?
It's the same.
Okay. This side and that. This and that.
Same.
And this and that.
Same.
Very good. Okay, now we're going to do some foot sensation. What we're going to do here is I'm going to move your foot from a position to say, we'll call this up, we'll call this down, and we'll call this in and out. All right, and what I want you to do is when I move you to a position, you'll keep your eyes closed again for this test. So when I get to that position, tell me what position we're in, okay?
Okay.
Flex that foot.
Up. Down. Out. In. Out. Down.
Good. All right, and then we'll move over to that other foot. Do that there. So again, same thing, in, up, down. Up, down, in, or out. Okay. So here we go.
Up. Down. In. Out.
And now our next test is going to be about, did I do that wrong? Sorry. Is going to be about movement. Okay, so what we're going to do here is you're going to actually mirror me. So I'm going to do this with your leg that's had the surgery. I'm going to start moving you up, and I want you to mirror that with the other foot, okay? So you'll have your eyes closed again, and then as I move, I'll move it, you wait, and then move it, okay? So we'll take you up, and I'll jiggle that foot out, and then I'll move, you move, good. Good. And one more. Good. All right. Can I stop? All right, Amanda, we've got one more test while you're lying down here before we get you sitting up. Okay, so what we're gonna do is measure the range of motion of that knee. So what I'm going to have you do is see how far you can bend that knee and bring that heel closer to your bottom. Right. Just take it as far as you're comfortable with. That doesn't give you too much pain. Is that good? Mm-hmm. Looks like we have 36 degrees of flexion there. Okay, so now I'm going to take you just a little bit further and see how far you can get there. All right, and just let me know when that gets too painful or you can't move it at all anymore, okay? Right there? Okay, hold that. And it looks like we have 60 now, that's good. All right, you can take that back down to that relaxed position. Okay, and then now what you're going to do is see if you can push that knee down to the bed as far as you can. Again, keep that pain in consideration. All right, is that all you have? All right, that's good. And you got 214, that's good. And now I'm going to take you down just a little bit farther if that's okay. Just let me know about the pain. It's okay. All right, let me know when it gets to be too much. There, okay. Got 9 now. Okay, and then just go ahead and relax, Amanda. So now we've got tricky. We're going to get you sitting up, keep you covered, all right? What I'm going to have you do, Amanda, is kind of shimmy up on your elbows, and then you're going to scoot yourself around in the bed, okay? And be cautious of the edge back there. But I'm going to kind of help you with that knee and getting moved around, okay? So let's make sure these covers aren't too fun. And get your shoes on. Right foot would help, wouldn't it? There we go. Good. All right. Covers untucked. All right, can you push up on those elbows? And I'll help you with this leg, so just slide on out. Good, and then scoot a little closer to the edge of that bed for me. Good, nice and stable. And then I want you to gently rest this heel. You're not gonna wanna be putting a lot of weight at all on that leg today, okay? Not even standing on it when we get up, okay? So you can keep covered there. gonna start, I'm gonna test the strength of that upper body, okay, just to make sure you're good with these transitions, reaching back, holding yourself up and stuff. Okay, do you feel stable sitting here? Okay, all right, so we'll do one side for time purposes today, although we'd always do both sides. So what I'm gonna have you do is raise that arm up out in front of you straight, okay, and then you're not gonna let me push down, okay? So hold that and relax. All right, I would give that about a 4, okay? And then now I want you to go back, and then don't let me bring that arm forward. Good, very good on that side, about a 5 on that one. Now you're gonna raise that shoulder up. Again, don't let me push down. Hold, 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 and relax. Good, 5 again. And then now you're gonna be holding that into your side. I'm gonna try and bring you out. Don't let me bring that arm out. Hold, 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 and relax. Very good, 5 again. Now I'd like you to bring that elbow up, and you're gonna extend out, and don't let me push you in, okay? So here we go, hold, and relax, good, another 5, and then elbow down, we'll test those biceps, don't let me push down, and relax, good, and then now I'm gonna do internal, external rotation, so don't let me push you out, okay? Hold and relax, good, other side, push out, don't let me push in, good, 5s on all those, looking good. Last one we have here with that forearm, it's gonna be supination, pronation. So yep, gonna have that arm up, just turn that up, and don't let me turn you over, okay? Very good, another 5. Now turn that hand over, keep that elbow in, and don't let me turn you up, hold, hold, hold. Good, I'll get that side of 4+. Okay, good. All right. Yep, there you go. So, testing those extensors, don't let me pull you down, hold. Good, 5 on that one, palm up, and don't let me pull you down. Look at this. Good, a little bit of movement, we'll go 4+ on that one. And then last one, forward hands. I'd like you to grab my fingers and just squeeze as hard as you can for me. Good. Good on that one. Another 5. Okay. I'll move this just a little bit here. All right, time to test that lower extremity strength, Amanda. So what we're going to do on this one, is we're going to test the, it's not quite, but let you uncover all the way. Keep that modest. All right, so it's going to be hip, and what you're going to do is just raise this hip up, and then don't let me push down. All right, we got about a 4 on that one, not quite as strong as the upper body, but it's okay. And then now, don't let me pull your leg out. Okay, so you test those hamstrings. So hold that. You have to brace yourself on the bed, and then hold. Don't let me pull. And relax. Good. We'll go 4+ on that one. And then now you can kick out with that leg extended out. Not quite all the way. Now, don't let me push this leg down, okay? Push, hold, hold, hold. And relax. Good. Another 5. All right. What I want you to do now is don't let me push this leg out, okay? Good. And then don't let me push in. All right, down to the feet. Pull those toes up towards you, and then don't let me push you down, okay? Hold, hold, hold. More 5s. Remove this really quickly. Hard for that big toe. Can you pull that up? Good. And then don't let me push that down. Good. Another 5. Good, strong big toe there. Okay, now let's do a little bit with this other side. We're not going to be nearly as strenuous as we were there on that left side. What I want you to do is just to see if you can raise this leg up, keeping that knee with the same bend. So see if that hip is strong enough. Can you raise up, raise up? Good, and then can you hold it? Good. A little bit. Probably go with like a 2+3 on that one. And then now I'm not gonna touch your knee, but what I want you to do is don't let me push that leg in. Test those adductors, abductors. So hold that, don't let me push in. Good, relax, we'll go with a 4 on that one, and then don't let me push out, okay? Hold, hold, hold. Relax, good. Another 4. Okay. And then we'll test that ankle, see and make sure that's not affected. Hold that up, and then don't let me push down. Good, and then that toe again, flex it up. Good, don't let me push down. Very good, a 5 on both of those. So it seems like that's not being affected at all by that knee, which is great. All right, Amanda, we're going to do that range of motion testing again here while you're sitting, because sometimes that will affect how much of a range of motion you can get. Some people get more while they're in that seated position. Okay. So what I want you to do is just see how far you can pull that heel in toward you again, bending that knee to where you're comfortable. And then is that where you're at with that? Okay, it looks like we have 55. All right, and then now I'm going to take you just a little bit further, and you let me know when that pain gets too much. All right, is that good? And then now we're at 61. All right, good, so we got more there. Now you're going to kick that foot back out. Take it to as far as you can push that knee extended. And then let me know when you reach that position.
That's good.
That's good. It looks like we have 15 there. Okay, and now I'm going to do the same thing. I'm going to extend it out just a little bit more. Let me know when that's too much. Is that good? We're at 5, so really good. We want to get you back down to 0 eventually. So that was more than I remember than when you were sitting. So final thing, Amanda, we're going to have you go ahead, put on a robe, lovely robe. There we go. All right, so one arm. You. Almost ready to get you down to therapy. Hold on a second, I'll help you out there. Okay.
Good stuff, everyone.
And then I've got a gait belt for our transfers. So if you can lift those arms up, please. And just let me, it needs to be snug, but we don't want it way too tight, so just let me know if it is. There we go. Alright, we can ditch that sheet there. So I want to get this wheelchair in position. Locking it. We'll wait until you're done to do that. Okay, Amanda. So what we're going to do is work as a team here. I'm going to give you some cues. Again, remember, don't put any weight on that leg. If you need help kind of moving it around, let me know. But I'm going to say 1, 2, 3, stand. And then you're going to do a little bit of a hop to get down here. You can use those arms and help lower yourself down into the wheelchair, okay? Let me know if your knee gets really painful, and it's fine now, right?
Right.
All right, so what we're going to do on 1, 2, 3, stand, okay? So 1, 2, 3, stand. Keep that leg up. Good. Okay, leg up. And of course, in real life situation, I would have a raised foot pedal for that right side. There you go. All right, Amanda, time to head on down to therapy.
Cover.
In case you get a little cold, cover you up. And we'll leave that gait belt and that robe on as well while you're in therapy. That way you don't have to show off all the goods, and they have that gait belt to help keep you safe, okay?